Dr. Newcomer is going to speak first, and our topic is future research and policy directions.
Thank you. It's a modest title for what I hope will be a fairly straightforward presentation. There are many ways to organize this paper, and within our group, we've had quite a bit of discussion about how all of the ways I've tried so far have failed to capture the true essence of all the issues. And I'm sure expending that out to the rest of this group, many will feel I have failed to give full appreciation to your topic. So I apologize in advance. There are many things that won't be covered. My approach here really has been to highlight what I think are some, for the most part, understudied and perhaps even emergent issues that look at, in thinking of the whole long-term care situation right now, we have this funnel, and most of our talks this morning have been about how to expand or how to broaden access to community-based care, and a lot of what I'm going to focus in on are some of the issues that I think Vera began to introduce in her talk as well. What about the receiving end of that? What kind of capacity do we have to respond to this movement of people into community settings, or the facilitating remaining in those settings? So most of the issues I'm going to focus on kind of have the common theme of tying back to that. One of these issues was, Steve mentioned it in his talk, and the importance of immigrant labor can't be underestimated, and I think projecting forward, the importance of that is probably going to grow substantially. And the research interest here, I believe, is to really understand the implications of that for cultural appropriateness in terms of the training of the workers, in terms of training of the consumers, in terms of how to work with immigrants, and other kinds of dimensions to this that play through our public policy and the way we do quality assurance oversight, recruitment, and so forth. A big issue. It's not on a research agenda yet, but I think it needs to be there. Another take on an old theme, the PAS wages and benefits. Now, Vera mentioned, and Steve both, the relatively low and for the most part fairly static wages that are here, and those are issues that need to be examined, and I think understanding why we don't have a more responsive system in terms of wages and benefits needs to be looked at. But the point I would add to that litany of issues is this: as long as we're working in a constrained budget environment, I have these concerns, and one of these concerns is this: that you can increase wages and lower authorized hours and still say this and still spend the same amount of money. And we haven't been talking about how that teeter-totter might work, but it's something we need to pay attention to in developing data systems and in tracking and evaluating this question. If we raise wages and reduce services, we haven't gained very much. We've maybe stabilized the workforce a bit, but not necessarily improved the overall delivery system. So I'm just saying, let's be balanced in what we look at, and look at how the systems are responding, how states are responding, how employers and so forth are responding. It may not be, we may not get what we think we're buying. This is a bigger issue, and we've talked somewhat today in the silo of PAS, but what I would like to emphasize here is that there is a big infrastructure out there called housing that is a critical component in long-term care, and one that we very seldom put together in the same discussion. We do know, we don't have good documentation of this, but we do know anecdotally that for years we've been allowing the populations to age in place in publicly subsidized housing. We do know we've got naturally occurring retirement communities of board and care and SROs and things like that. We've got probably a pretty large stable of affordable housing that's being used by the non-elderly disabled. These are non-licensed facilities. The very intention is that they remain non-licensed. But the fact of the matter is we need to have a coordinated policy that says, if we're going to have people living in the community and living independently, that is not with their parents, they're going to have to have a place to live, and that place has to be affordable, and it has to also have access to appropriate PAS services. Now, we haven't had a policy that tracks that. We don't have a data system that looks at the implications and repercussions of it, and I would suggest that we need to move in that direction. And a key part of this here is this, that within the population living in this kind of housing, many of them are receiving some form of PAS. What we don't know is how much. We don't know what form it takes, whether they're getting, one person's getting their provider and that provider goes home, or whether people are sharing providers. There probably are situations where sharing of providers is controversial and from the standpoint of consumer direction. But how the system works, how it could be refined, how it could be made more efficient, and the overall cost coming out of that needs to be understood. And I'm going to talk in a second about some of those costs being Medicare. We do have residential care as a market, as a delivery system where this kind of integration has happened at the point of licensing facilities, and I think that may expand, but I think the more likely thing to expand is a coupling of subsidized housing and PAS type services. So I do think it's a very important issue. Something else that hasn't got a lot of talk today, at least not as in the same sentence, but that is when we've got paid PAS services, how do we make that support the informal system that very often these are coupled up with? We need to think about that in a much more concerted and organized way. We do have one program that's kind of an example of how that might work, and that's the Cash and Counseling program. Now, basically, what we're offering here is a voucher payment to a family and saying to them, take this money and put together, within the constraints of the money we're giving you, put together a package that makes sense for you. One element in that package is sometimes paying legally responsible relatives to be providers. Now, does this work? Does it have bring in more people than we want in the system? Does it have a downside? There's a lot of issues like that that are being evaluated and will probably be looked at very critically. But some of the other aspects to this that I think we also ought to examine, and this would be true in any system where we're paying relatives to do the work, is as a short-term strategy that may be very viable. As a long-term strategy, it may not be sustainable for that individual. It may be too burdensome to not have any relief from the responsibilities, or on the other hand, it may be very elastic. So there'll be certain situations where this will work great, and some where it might work great for a while, and others where it will never be possible. But we need to understand that. We need to try to bring our policies together so that they are trying to articulate better with the infrastructure that's out there, in this case, the informal care.